am Dr. Ore. And welcome to the oh so quiet ear examination room. Yes. I've been hearing that you're having a bit of trouble with your ears, is that correct? Mm-hmm. And a nurse saw you prior. Is that true? Yeah. So, what seemed to be the problem with your ears? Mm-hmm. Mm-hmm. Okay. So you're having a bit of sound difficulty between one ear and the other. Okay. And would you also say there's any pain or sensitivity around any of the ears? No idea. That's okay. I'll be taking care of you today. So please, get yourself cozy, sit down, and I'm going to just put my notebook down. I'm going to begin with just a bit of a preliminary look around your face. Is that okay? Good. May I just carefully put my hands around your ears, like so? Thank you. My hands are clean. Just want to feel around your ears. Any pain or sensitivity? I'm going to be going next to one ear and creating a bit of sound. I want you to tell me which ear I create sound by, okay? So, be very alert. It's very small of a sound. Just going to put my hands right next to your ears, okay? So, good. 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 Very good. Perfect, both. Good again. Good. Very good. 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 Very good. Very good. Okay. And I'm just going to grab a light really quick, and then I'll get my very lovely otoscope. I'm gonna just take a look around the perimeter of your ears, okay? Gonna put pressure on it. And this is a bit of an exam. I'm going to just touch all around the ear. I want you to let me know if you're feeling any sensitivity along the ear. Here or here, okay? Thank you. I'm gonna just quickly use a light. I'm gonna start up with this ear, okay? Just going to go in and take a quick look. If you would like to look at my ear to distract you, that would be good. I'm gonna just touch around your ear now, okay? Good. Any pain? No. Any pain? Nope. Any pain? Okay. Any pain? which ear would you say is having the more difficulty with hearing, left or right? Okay, good to know. Let's take a look into the other ear now, okay? Keep looking at my ear if you would like to just distract you, but I'm gonna just touch right here. Now, let's see. Any sensitivity? No. There? Nope. Any pain? No. Any pain? No. Any pain? No. Any pain? No. Okay. Thank you. Next, getting my otoscope now. I'm just gonna pop these into your ears and take a look right into your ears, okay? Good. And it's a bit funny looking, but there's a screen in the back I'm going to take a quick look into your ear with. Just gonna look into your ears. So, good distraction is just look at mine. Let's take a look at this ear first. I do apologize if it's a bit cold, but I'm just gonna put this right there into your ears and take a twist and look. So, okay, swelling, irritation, and wax buildup. A lot of irritation, it looks like. Infections. Okay. Have you experienced any trauma with this ear? Okay, that's understandable. I do see that it is experiencing a lot of fluctuation. As well, the eardrum is impacted by wax and a bit of inflammation, which is causing you to probably have a bit of hearing problems. Okay, I understand. I'm gonna check the other ear now. Just really quickly, don't move. I'm just going to take a quick look. Putting that into the ear canal and then twisting just a smidge. We're gonna take a quick look, okay? I do apologize if this is irritating at all. Are you okay? Good. So, I'm going to say that this is also just a dash irritated, but there is not a lot of wax buildup. So, I think that it is fine. So I'm going to go in and clean the ears anyways. Okay. Thanks for letting me do that. I'm going to apply an anti-inflammatory drop first. And just going to add this into your ears. Just tilt your head a bit to the side. Thank you. I'm going to drop that right into your ears. 1, 2, 3. And tilt your head this direction. Thank you. Just going to add drops into your ears. 1, 2, 3. And this should help with the pain. I have a tuning fork here. And what this is going to tell me is if you can actually feel the vibration within your eardrum and if there's any problems with sound. I want you to just close your eyes for this very carefully, but pay close attention to what I'm going to tell you. I'm going to hit this tuning fork. It produces the note C. And I want you to let me know if it's closer or farther away from your ears. And I'm going to ask you which ear you hear it on. I'm going to only do 2 different distances per ear. So, one might be a bit closer, one might be a bit farther away, but you won't know which one is first. Okay? Very good. So close your eyes. I'm going to hit the tuning fork. And I'm going to put it next to one ear. And at first I want you to tell me if it is left or right. Okay? Good. So, I'm just going to hit the tuning fork now. And I'm just going to put it next to one of your ears. was that? One more time. Okay. And what ear was that? Very good. That was the left. Now, I'm going to just carefully, same ear, and I'm going to ask you if it's going to be closer or farther away. Good. So. That was tone 1, and here's tone 2 to compare it to. So, was tone 1 closer or farther away from your ear? Very good. It was closer. Let's test again. Other ear. Okay. Left to right ear. Very good. Once more. Great. Now, I'm going to give you tone 1. And now tone 2. Now, was tone 1 closer or farther away? Very good, farther away. Now I'm going to hit the tuning fork. Place it right on your ear. I want you to let me know if you actually feel any vibration of the sound in your eardrum, okay? Good. A little bit harder. There you go. Were you able to hear it? Once more. Any vibrations? So a bit of difficulty with this ear. That's understandable. We'll work on this one a bit more. Any problems hearing? A bit, okay? Let's try that again. Did you hear the vibration of that one? Okay, that's very good. So, that just means that one of your ears is having a bit more difficulty being able to hear, but that's no big deal. I promise. I'm going to clean your ears now, both left and right. I'm going to pop back in and take a quick look and see if there is any decrease in the swelling that I saw from earlier. And if we can just remove a lot of the wax buildup, okay? Very good. What I'm going to do first is get a bit of a aid for your ears to remove the wax, okay? Good. Gonna get a glove first. Okay, good. I'm going to apply a anti-wax spray into the ears, okay? We've got one here. And it's going to properly sanitize the ear and also help the wax buildup not be so much. Okay. So I'm just going to shake that a bit. You okay? Good. Does it feel a bit lighter in this ear? Because it actually should. Okay, very good. So, I'm gonna just place it right next to the ear, spray around the ear, okay? Just sit still. I'm just going to go right back there. Okay. Very good. On to the next ear. Let's just pop around, take a look. Just take a quick look again. Okay, you pop back and taking a look. Okay. Gonna see it's the same as the other ear, but let's build up. I'm gonna get the stool again. I'm just going to go right into the ear, okay? If you feel any discomfort, let me know and we'll stop. Good. So just going to go right in. I'm going to use my tool here. I'm just going to okay. Okay. I'm just going to clean that very carefully. Okay. How you feeling? Good. Gonna go back in, just cleaning the ears. Okay. Just going to okay, any pain or discomfort? Okay, I'm going to apply a bit more of the ear wax dissolver. So I'm just going to get on this side of the ear again. I'm just going to spray this into your ear. Okay. Now I'm going to get a bit of a cotton round little Q-tip. I'm going to work that right into the ear. Just carefully. So. Flip it to the other side of the ear. Okay. Very good. And now I'm going to apply an antiseptic to the ear. There was less wax in this ear as there was the other, but I knew that since we began. So I'm just going to step right back here now. I'm just going to spray this right into the ear. grab my otoscope again, take a quick look into your ears, and see if there's been any change in the insides of your ears. So, I'm gonna pop around, take a quick look with this ear. So, just going to put that into the ear canal. Take a quick look. There's no more blockage in the ears, though there is almost next to no normal amount of wax there, and it's good. And I do see the inflammation's down as I prescribe the antibiotic. So, this ear is doing amazing. Let's look at the other one very carefully. I'm going to put that right into the ear canal and then twist and take a look. I would say that this one, though it had less wax than the other, actually is looking magnificent. A bit less irritation than the other ear, and it looks like all signs are clear and clean, which is perfect. So, I'm just going to quickly test your ears again with my tuning fork, and we're going to see how your progress has been, okay? Good. So, just taking a quick look. Any vertigo or any signs of pain in your ears? No. Okay. I'm going to put pressure on your ears really quick, and I want you to let me know if that feels uncomfortable or if it feels like you're underwater. Okay? Very carefully. Okay. Carefully. Okay. And carefully. Okay. Any signs of uncomfortability and pressure along the ear? No. Okay. And quick sound check. I want you to let me know if you feel like you hear the sound clearer in each ear, okay? Good. So, just let me know which ear you hear it in. Good. So, left or right? Once more. Left or right? Very good. Left or right? Left or right? Very good. And would you say the sound is clearer or less clear? Good. Now I'm quickly going to put this on your ears, like I did prior, where I hit the tuning fork and I put it on your ears. And I want you to let me know if you can hear the vibration of the tuning fork on this ear again, okay? Good, so. Once more. Okay. And you can. Perfect. Other ear. Once more. And you can. Marvelous. So, I'm going to say your hearing has improved by a lot. And I would say that you can hear quite a lot of things now. I'm going to quickly write a prescription for an anti-inflammatory ear drop for the ears and an anti-wax buildup drop for the ears as well, so that you don't have to come back in here and ask me to do it again, unless of course you need help. I want you just to feel safe and to feel healthy, okay? And I want you to hear everything around you. Good. And I have my prescription here. I'm going to send it to the front desk. And your score prior for your ears is that your left ear was experiencing a 5 out of 10. Your right ear was experiencing a 2 out of 10. And we rank this a scale off of sensitivity, sensory pressure problems, your reactions with your face to sound, and overall reaction and delay. Now I would say your ears are both a 10 out of 10. Very good. So, just circling the proper numbers here for that. And I'm going to send this prescription into the front desk. I want you to grab it as you walk out, and I want you to have yourself a very amazing day, okay? Again, I am Dr. Ray. If you need any help, or if you want to get your ears checked again, come back into my office, okay? Good. Have an amazing rest of your evening. It's a pleasure to meet you.